Hi, I'm Liz Kroll. I'm a nurse with the MassGeneral Hospital for Children. I work in the PICU here. And I just wanted to speak about the post-operative care for our Operation Airway patients. The most important piece of the post-operative care is secretion management. After these surgeries, children have much more thick secretions, many more secretions, much more thick than usual. And that puts them at risk for occluding their trach, which could be a dangerous situation for these children. So one of the most important things that we can do in order to prevent this is to promote humidification of the secretions to keep them nice and thin. So really important to be assessing secretions to make sure that they are thin and pass easily through the trach, as opposed to being very thick where they're more likely to clog. Initially, secretions may be bloody, putting them at even greater risk for occluding or clogging the trach. In order to keep them nice and thin, 2-3 drops of normal saline or 0.9% sodium chloride can be instilled directly into the trach, and then have the child cough afterwards, or if they're unable to cough, then to suction them as directed afterwards. In addition, a normal saline nebulization every 2 hours can also be very helpful. It's especially important to communicate to the providers that secretions are changing or becoming more thick so that it can be intervened right away. Only normal saline should be used for nebulization or installation into the trach, because using any solution with anything added like dextrose or electrolytes could put the patient at increased risk of infection or complications. Alternatively, sterile water is less optimal because it can actually make it more difficult for the patient to cough out their secretions or induce bronchospasm. The team should be notified for any change in secretions, especially any blood seen once the patient is on the ward, and also if the patient is developing more difficulty breathing, so using accessory muscles to take a deep breath in, or if the sound of breathing through the trach changes, especially if it becomes more high-pitched, or if the patient reports any difficulty breathing.